I am Chris Sanders. I'm Senior Vice President for the Northern Market Growth and Development team. We've been gearing up for our expansion to get ready for our new tower that is coming online later this year. As our communities and our population continues to expand, I want to be able to expand the care that we provide based on the needs that they have. Developing new programs and specialties such as endocrinology are very important to our growth here in this market, and providing it here closer to home is so important to all of us here.
I'm Abha Chaudhry, pediatric endocrinologist. I'm the medical director of the diabetes program. We follow about 2,500 children with diabetes in the DFW area. Tzield is the first disease-modifying agent approved for stage 2 type 1 diabetes. Tzield can delay the progression of stage 2 type 1 diabetes to stage 3 type 1 diabetes by approximately 2 years. It's a 14 consecutive day course of an IV infusion. Once it was FDA approved, we found a perfect location for this treatment here at the Plano campus. I'm excited to say we were the first ones to offer this treatment in the DFW area.
We were first brought to Children's when our first child got diagnosed with type 1 diabetes, which that was really hard for us to even fathom, because at that point we didn't see any family history. We were pretty shocked by that diagnosis, and he stayed in the hospital for a full week. And that's when we met Dr. Adhikari. We were doubly shocked a year later when my 9-year-old started to show symptoms. And I was pretty much like logical about it and matter of fact about it until we stepped foot onto the same wing where we had been a year before. And I'm like, oh, this is happening again. We're in good hands. We've been here before. They have been amazing to us here at Children's Health, and they're going to help us.
I've been here at Children's for about 20 years, so I've known Jesse for about half that time. If you're a parent and you have multiple kids with type 1 diabetes, that's a burden that we and our team try to recognize and try to respect and try to do everything we can to lift that burden off the shoulders of the families that come to see us as much as is feasible. She wanted the absolute best for her kids. Little did we know that this would be the beginning of a journey together for us.
When the first child was diagnosed, we were offered TrialNet screening. We did the screening, and Mohammed's results came back. He was positive for all 5 antibodies at that time, and he was around 5 or 6 years old. So since that time, there's been an indication that he could develop type 1. It's a huge change in your life when you need to start taking that insulin, because you have to start counting every single thing that you eat. You have to monitor the blood sugar 24/7 through the night. It's a manageable life, and we're thankful for all of those things that make it livable. But if somebody can avoid that, even if just for 2 more years, that's really valuable. So when Tzield was offered to us, I was definitely interested in trying to delay it as long as possible. I think the reason that we're able to live so successfully with diabetes is because of the education that like Dr. Adhikari and the Children's Health Endocrinology team provided for us. It was a blessing that Children's Health Plano campus was the first one to be offering that, but it wasn't a surprise.
It's been really important to us to try to meet our kids wherever they are. Being available up north is a big part of that for us. A good third of our ambulatory volume is delivered on the Plano campus. So it's been a big part of what we do for a long time.
We're an organization that actually has a vision and a mission that speaks to my heart, which is to make life better for children. This place is remarkable, and that's due to the community and the culture that we have built here. We're a family, so being able to extend that family and to grow that family along with growing our physical footprint here is what we're most excited about.